Have you hit a brick wall with your weight loss program? It's often referred to as a plateau. You were doing great, motivated, losing weight, and then boom. You say, I'm doing everything right, but I'm not losing weight. But there may be some underlying factors you might not be familiar with. Here's my friend and colleague, Dr. Michael Berglund, with some insights that may help.
It seems like every month I have patients come to my office and they're complaining about their diets and how they can't move beyond the current weight they're on. And I empathize with that because it is a struggle, and they're working hard and they're exercising, and it's always painted to them calories in, calories out, and you should lose weight. That's all it is. But the reality is far more complicated than that. The idea is that there is calories in, right? So that's the amount of food, calorically speaking, that you're eating. And then there's calories out, which is the amount that you're burning as fuel. But then there's also a whole bunch of metabolic processes, biochemical pathways in the body that need to happen for your body to actually lose weight. And those are the things that are important to any weight loss program. So the biggest things that are going to affect people in their weight loss is the metabolism problems. And the metabolism problems are almost always hormonal. Now they're different hormones, right? You have hormones like insulin that manage blood sugar metabolism and control, and if those get out of whack, you can get conditions like diabetes. There's a growth hormone that's helpful at putting lean body mass and bone density, even after we're done growing. But that's not a really big one. Probably the second most difficult one is testosterone. Testosterone, if we're not at high enough levels, our body won't be good at making lean body mass. And if there's too much estrogen compared to testosterone, your body will actually want to lay down more and more fat as a response to that sex hormone. So we always want to address testosterone, but the main one that we see the most often, the most common one, is thyroid hormone. Thyroid hormone is the body's dial. I call it the metabolic dial. We turn it up into the system, and when we turn it up, the body burns more. If people are hyperthyroid, which means too much thyroid, they will actually probably burn too much body fat, and the concern will be they'll start going into burning some lean body mass, and it'll mess them up as far as even breathing goes because they lose too much muscle mass. When it comes to hypothyroid, the body is more than content to just store fat because the metabolism is just so low. And you may think, well, but here's the thing, the doctor actually ran my tests, and my tests show that my thyroid's fine. And my answer to that is maybe. I mean, it's possible that your blood tests are correct, but you need to go find a chart that deals with hypothyroidism and to see how many of these symptoms do I have. If you have an overwhelming number of the symptoms that are typically associated with hypothyroidism, you probably are hypothyroid, and the blood test is probably wrong. So those symptoms would be things like fatigue. Now, this is like, anybody can have fatigue. You're right, anybody can have fatigue. So the other ones that are really common are swelling. So people have something called myxedema, myxedema, and that's where you have swelling in the hands and in the feet. A lot of people that are low thyroid are also cold a lot. They have a hard time managing their body temperature. And a lot of times if you take their body temperature, they're in the 97s, sometimes even 96s, and we're supposed to be 98.6, so we know that's a problem. Obviously, weight gain, when they should be losing weight or staying the same, is one of those things that we look at when there's hypothyroidism. Some other things that are really common are dry skin, dry eyes, constipation. Another common thing is hair that falls out really easily, nails that crack, break, and peel. There's some people that actually have these chronic calluses in the backs of their heels or on the palms of their hands, and they don't have a good justification why they have those calluses. A lot of times that can be from hypothyroidism. So if you're looking at this list, this is a very quick list. But if you're looking at this, you're going, gosh, I have a lot of those problems. Then you may actually be hypothyroid. Now the problem is you're going to go, well, the doctor says I'm fine, so how are they going to treat me for this? And the answer is, well, the doctor was just going to treat you with some synthetic thyroid hormone anyways. There are actually some natural supplements out there provided by wellness practitioners and alternative practitioners that are known to support the thyroid. And the good thing about these types of products is they actually support and make the thyroid function stronger. So in essence, someday, if you've been on this long enough, and long enough could be 2 months, it could be 10 years, but we don't know. It depends on person. But you could theoretically lower your dose or even get off some of these thyroid supplements, because we're actually giving them the thyroid nutrients to do its job better. There's always this analogy, give a man a fish, he eats for a day. Teach him how to fish, and he eats for a lifetime. If I sit there and give thyroid hormone to a human being because they're hypothyroid, I will always have to give hypothyroid hormones to them. If I strengthen their gland, there's a possibility that someday their gland might get it and be able to function on its own. So if you happen to be struggling with weight and you just can't seem to get off the plateau, and changing your diet and increasing your workout doesn't seem to play a big role in it, I'd see someone and try and fix a metabolic problem and see that doesn't help you get off the plateau. It's no fun being on the plateau.
It's important to remember that your body chemistry is unique, and what works for a friend or family member may not work for you. You really can lose weight without those long plateaus, but it may take a little detective work. Your wellness clinician offers testing, monitoring, and nutritional coaching customized to your unique situation. If you're struggling on your own, instead of giving up, give your wellness clinician a call and lose the weight for good.